Dr. Shuvro Bhattacharya, and my today's topic of presentation is the perception and the experience of the medical student regarding the integration of the AI tools in the collaboration in the clinical discussion and the decision making. For that, we know that COVID gives the challenge to the medical field for the teaching purposes, which is come in the online platform. And in the online platform, AI is the most important tool in now this era. And the integration of the AI tool in the medical field is the enhancement of the medical education, augmentation decision making, improving the diagnostic accuracy and the collaborative particles in the health professions. And we all know the medical education in the India is very complex and limited integration is there. And the integration of the AI depends upon the upcoming future generation of the medical field, like the interns. And interns need some basic training, and the role of the training is mainly the skill development, knowledge enhancement, improving the patient outcomes, and the professional development. And they are the chatbots which is present in this era. And to explore the medical students' perspective on the AI tools in the collaborative clinical decision making, and to find out the area of the training in the integration of the AI tools, we go for the cross-sectional observational study in the medical colleges of the West Bengal in the 3 months period of the interns of the 1057 students. Census sampling method was done, and those who did not give their consent we exclude from our study. Pre-designed, pre-tested, expert-validated, cell-administered structured questionnaire including 15 questions with yes or no 2 options is our studies tool. After taking question, we give the Google Form survey, incomplete questionnaires are excluded, then data was entered and analyzed. Now coming to the results, among 17 questionnaires is invalid and 1057 is the total valid response. Among them, 613 is the male and 444 is the female respondents of our study. This is the age and the sex distribution of our study population. And only 10 to 15% of our study population know about the training process of the AI is present in the India. But more or less, more than 50% of our study population believes the AI contribution should need it. But below the 50% in the male and the more than 50% in the female, they think the improvement of the collaborative decision making should be there. And stimulation of the real world clinical scenarios is improving by the AI uses, but decreasing the communication and the information, and also decreasing the confidence of the doctors using the AI tools. But it will provide the valuable insights and the suggestions when we use the AI tool, and more or less 50%, more than 50% of our population thinks that AI will reduce the errors and improve the accuracy. They encounter many challenges and the barriers when they use the AI tools, approximately 70% of our study population. But more or less 80% of our study population thinks that AI tools should be integrated with the medical educations. Now coming to the discussion, we all know in the present scenario, AI can schedule one appointment to monitor one patient schedule, each and everything. And 24/7 one chatbot is present with us which can tell us the clinical sign and symptom as well as call the helpline number by the AI only when there is an emergency. But there are some privacy and security concerns, handling some sensitive medical information, and something accuracy information is ensuring in case of when we use the AI. But we cannot forget the haptic which is used and help the 1.1110 million people in the COVID era use the COVID bot. Now, may I ask my chatbot, can you make slide? Yes, future trends can be there. There are some research papers which tells us the medical fields is now collaborating with the AI. There are some case studies also. There are 14 case studies also developed and is done from 2017 to 2023. That shows us there are multiple uses of the clinical field. And there are some 4 or 6 chatbot case studies also. In the India, there are 3. WHO also provide the AI ethics and the governance, and Howrah Man, which developed the Bravo, which is a robot which is helping the autistic child, and Health Minister also launched the MedTech Mitra for the advanced healthcare. And there are some available courses for the medical field for the AI learning. Every state has a limitation, mine was no exception, like only few students studied from a single state and other factors may be there, but still my study is unique, but first of its kind exclusively in the UG students, and it can help in the AI modulation in the upcoming areas. For the conclusion, I want to say we cannot forget about the human touch also. This is my references, And I want to thankful to Dr. Arup Chakraborty as my guide and Medical College Kolkata for giving this platform. Thank you.